So believe it or not, we are already at our last hypertension medication. Now, you might feel like we've been here forever. I feel like we've been here forever, but hopefully breaking it down like this made it a little bit more manageable. So calcium channel blocker wise, there are two types of calcium channel blockers. There are dihydropyridines and there are non-dihydropyridines and all this stuff. But what it really comes down to is that, the medications when we're talking about blood pressure, because, the calcium channel blockers, the non-dihydropyridines, those are used for dysrhythmias. And we actually don't talk about dysrhythmia treatments, but you'll learn about it in complex that some calcium channel blockers are used to help with dysrhythmias, convert or lower heart rate. But the other type work more on the blood vessel side. So these are the ones that we use for hypertension. So and this is going to be one you're going to see commonly used. If you have not already, it's called amlodipine. And so it is very potent, can work on blood vessels, and effectively it relaxes the blood vessels. It is possible it could decrease some of the electrical activity or decrease the heart rate. So this is another one that I want to monitor the heart rate. And when it says, why would I need to hold this medication? If my heart rate was less than 60, I would consider whether it's safe to give. Now, again, these don't work as directly on the heart. I'm not going to give amlodipine for a dysrhythmia, but it's possible they do have some of the same properties. This might also bring back some vasodilator vibes because they cause peripheral vasodilation. They can have swelling in their lower extremities. And I want to monitor their intake and output. We might need to monitor their weight, just like with vasodilators, because there can be that pooling. Remember, think vasodilation, it's pooling. The other thing that is different about this than any other med that we've talked about so far is that it can have a side effect of gingival hyperplasia. If you're wondering what that is, effectively it's where your gums get extra thick and like there's extra tissue that forms on them. And so we really want to encourage very good dental hygiene and regular dental checks, as this can be a negative effect. Let's do a practice. So, patient is on amlodipine 5 milligrams PO daily and spironolactone 50 milligrams PO daily. Is this safe to give, or is there anything we need to check or clarify first? So again, we always want to look at this. Every problem we give you is not necessarily where you need to do something about it, but let's check this one. So amlodipine, there's and spironolactone. So I have to think, is there anything with amlodipine and potassium? Well, there's nothing about amlodipine that I talked about that has to do with it lowers or increases your potassium. The other thing that you might be wondering here is, can we give these at the same time? You can. So like in the morning when patients have hypertension meds, sometimes they have 4 meds. We give them all at the same time, as long as their blood pressure meets the parameters that the doctor has set. So don't think like we have to space these out or we have to do something special with these meds. These are 2 hypertension meds. There's no interactions between them. We make sure that their blood pressure is at a stable level. So for every patient, before I give a blood pressure medication, I like a blood pressure within the last 30 minutes. Now, I know that there's going to be, some people that are going to say, like it's been a couple hours, I'm sure it's fine. But I've actually had it happen before where I was going to give a blood pressure med with a student, and they said, oh yeah, at 7 o'clock their blood pressure was fine. We took it again just because I wanted the student to get experience, and their blood pressure actually was too low to give the medication. We had to hold it. So I'm glad we checked again. Now, does that happen all the time? Maybe not, but it's always better to be safe than sorry. So I'm checking a blood pressure before, so I'm still going to check their blood pressure, make sure it's okay. But otherwise, there's no reason not to give this calcium channel blocker and this potassium sparing diuretic. I might check a heart rate before too. That's the only thing I can think of. But it's not going to, unless it's super low, it's not going to stop me from giving this. And there's no interactions between the amlodipine and the spironolactone. I think that's it. Yeah, we'll do that one next. Anyway, you made it through the meds, on to nursing interventions, diet, exercise, lifestyle changes, and all that fun stuff for hypertension. See you there.